We're going to open the testing facilities for all people who are at a protest. One person can infect hundreds. If you were at a protest, go get a test, please. The protesters have a civic duty here also. Be responsible, get a test, go to the website, find out the testing site nearest you. We have 700 in the state. You can get a test, get a test.
As thousands of Americans continue to take to the streets to protest the death of George Floyd and systemic racism in this country, there is a growing concern that these large gatherings could spur more COVID-19 infections and make a second wave of the coronavirus in the fall much worse. In states with some of the largest marches, the number of newly confirmed coronavirus cases are skyrocketing. Take a look at this graph. Out west, states like Utah and Arizona are already signaling a sharp spike. And in the south, North Carolina, Florida, Arkansas, and Mississippi are just a few states with cases trending upward in recent days as urban areas see an influx of demonstrations. Now, it's hard to say exactly how risky these protests are or what to expect in the coming weeks, but I want to bring in Dr. Andre Campbell, a trauma surgeon at Zuckerberg San Francisco General Hospital and a professor of surgery at the University of California, San Francisco. Dr. Campbell, good to see you again. Let me just ask you about this, because I've been on the streets in Minneapolis and Chicago, in New York. These protests are definitely not socially distanced, and in many cases, people are not using masks. What do you see when you look at them?
Well, so this is what I see. Good morning, Ali. Thank you so much for having me on again. The first thing I want to say is that we as healthcare professionals are really very, very concerned about what is going on with the protest, because first of all, everyone has a right to protest. Let me say that. And what has happened is an absolutely terrible thing related to what happened in Minneapolis, number one. So they have a right to protest. But what happens is, because there's so many people, there is a potential for what we may call a super spreader event. We know from the literature and what's been published is that there was a choir practice where 58 people were there because people were singing, they were with each other, they were in close spaces. Over 50 people got the infection, 4 of them got sick and died. So this kind of thing is a very big potential, because what we have been preaching for the last 85 days is, because we don't have a vaccine, social distancing and wearing a mask, staying at home. But this is the exact opposite of that. So this second wave, we are really quite concerned about happening, and it looks like it may happen. We hope not. We're praying against hope. And I think what the governor just said about getting testing if you've been exposed or you've been out, I think it's the thing we should do.
Yeah, in fact, when you think of all the things that shouldn't happen, we've been talking for the last 85 days about prisons and whether they're good places. Here we've got the CDC Director Robert Redfield in testimony on Thursday saying tear gas, which causes people to cough, could possibly help spread the virus. Densely packed crowds, people projecting their voices. You project more virus when you sing or chant or yell than you do when you talk quietly. And then the number of arrests we've seen, detainees stuffed into small vans for transport to jail. All of these things work against everything we've been discussing for the last few months.
It is exact wrong thing that you want to do if you want to contain a pandemic. You know, Ali, I have to feel sorry for you, because you were the subject of a tear gas attack in the street to clear the crowd, and you know what it does. Tearing eyes, running nose, coughing. The coughing 6 feet, it can go past that. So if you're coughing, you're spreading the virus. Now, the thing that we worry about is two things: is people who are asymptomatic spreaders and people who are basically have a test that is a false negative, because they may feel fine and they could spread the virus. And you don't know if you have it or not. That's why everyone should have a mask if they're going to go to these mass protests. And we should try to keep social distancing as we can. But if you're being detained, you can't do that. If you're inside a car, you can't do that. If you're with 100,000 people, you can't do it.
Dr. Campbell, good to see you again. Thank you for joining us. Dr. Andre Campbell is a trauma surgeon and professor of surgery at UC San Francisco.